Welcome to Health Connections on KCAT Television, Los Gatos, Montserrat. I'm Dr. Stuart Menakar at the Palo Alto Medical Foundation, Los Gatos Center. On today's episode, I'm with my colleagues, Dr. Brad Perkins from the Department of Family Medicine and Dr. Kristin O'Sullivan from our Department of Pediatric Urgent Care. Welcome, guys.
Thank you.
Thanks for being on the show.
Oh, no problem.
On today's episode, we're going to talk about summertime. A really happy subject for all of us, I hope. And our goal today is help you, our viewers, understand a few risks of summer excitement and fun that could cause troubles for your health. Well, it's summer. We're in beautiful Northern California, and the sun shines pretty much every day. Kristin, tell us a little bit about some of the troubles we might have to worry about from sun exposure.
Well, sun exposure can cause multiple different issues. Sunburn is the one that you think of first, right? Because that's the most obvious one. And we'll talk about how to prevent sunburns and sun exposure issues. But also not to forget heat stroke or heat exhaustion, which can also be caused by being out in the sun for too long.
Brad, why do we worry about sunburn? I mean, I know it hurts, but what's the big deal about having a little sunburn now and again?
So the main problem is long-term exposure to sun and sunburns can lead to cumulative damage over time that causes skin damage that leads to skin cancer in the future.
Right, so we want to protect everybody from excessive sun exposure, and especially the little ones, because the more serious sun exposures or sunburns you have, the greater the risk of skin cancer. I think, if I remember correctly, our dermatologists tell us that if you've had more than 5 sunburns in your lifetime, it doubles the risk of serious skin cancer called melanoma. How do we protect the little ones from sunburn?
Most children were able to have them avoid sun exposure, ideally between the peak hours of sun, between 10 a.m. and 4 p.m. If you can stay in shaded areas, that would be ideal. Also, long clothing, lightweight, long sleeve shirts, wide brimmed hats, sunglasses, those can all limit the exposure to some degree. However, you're going to have some skin that's exposed, and in order to prevent sunburn, we use suntan lotion. In small children, we would suggest children that are 6 months of age and younger do not have sunscreen applied, just for safety issues. However, children that are 6 months and over should have a cream or lotion ointment applied of an SPF 30 or higher in small kids. The sunscreens that we have available include chemical and physical barrier sunscreens. The physical barrier sunscreens like zinc are suggested for smaller children and for people who have skin sensitivities or eczema. So those have zinc oxide in them. And again, SPF of 30 or higher for small children. You're looking for a broad spectrum sunscreen. So when you look at the bottle, broad spectrum should cover against UVA for skin aging, UVB for sunburn protection, and applying regularly. 30 minutes before you go out into the sun is the ideal time, as it takes some amount of time for the sunscreen to be active. And then you have to reapply every 80 to 90 minutes for small kids, particularly when they're getting in and out of the water.
You know, Kristin, when we're talking about sunscreen, I'm reminded that many of my patients, friends, tell me that, I have dark skin, I've got this great Mediterranean complexion, I don't need to wear sunscreen. What do you think of that?
Even if your skin doesn't burn, you still need sunscreen. The risks of melanoma are still real. That's the skin cancer that we worry about. So making sure that you're applying 2 tablespoons of sunscreen, that's an ounce of sunscreen, every 90 minutes to 2 hours on all of your exposed skin still is important. Light skin, dark skin, doesn't matter. You still need to do it.
We want to protect our skin from the sun with physical barriers, clothing, zinc oxide, and chemical barriers in our suntan lotions. Besides sun protection, in the summer, one of the biggest problems is heat. So Brad, tell us a little bit, if you would please, about how heat affects us, young and old.
All right, so as you can tell, the heat is affecting me. I'm sweating a little bit out in this warm, sunny day.
Yeah, so we all are.
Yeah, but sweat leads to dehydration, and it affects younger and older people a lot more than adults. Babies do not control their temperature well at all. So it's really important, as Kristin said, to have the barrier protection for the babies. If you're comfortable being clothless, the baby should be clothless. Don't wrap them up. get them unwrapped because they can start sweating a lot easier than us. For older people, they're more sensitive to the heat because of certain medical problems, especially heart failure, and they can cause problems with more swelling, more problems breathing. So it's important to stay inside in the peak heat hours between 10 and 4. There are cooling centers around the area. Usually the community centers will have them for really hot days, over 90. You just have to make sure you're well hydrated in that instance also.
I'll put some simple measures when, not everybody wants to go to a cooling center, but are there some things we can do with the kids are outside playing, in the sandbox on the swing set, but it's pretty hot, they're getting overheated. What other simple things can we do for them?
Simple things are make sure they're well hydrated, make sure you give them water. If you have a cool mister spray to keep them covered, add an umbrella over the play area if you can, just to protect them from the heat, and give them a break inside if you have air conditioning where it's going to be cooler. Sit in front of fans, break every hour.
And Kristin, do you have other suggestions for kids?
Sure. We can do popsicles, some cool sports drinks. Keep them with low sugar, of course. We don't need too much of that. Playing with the hose a little bit. Drought-ridden California, maybe limit that to some degree, but a little bit is okay to keep cool. Maybe a kiddie pool, just filled a small amount with close observation, of course.
And how much water should the kids and adults too? How much water should they drink? And how do we know they're getting enough?
Kids should drink about 5 ounces every 20 minutes of active play out in the sun, which is quite a bit. So keeping cool drinks in an ice chest right by where they're playing and allowing them free access to that. That's really important, particularly when you're talking about sports camps or activities outside like at the Y, where kids may not realize that they can go to the water fountain, that they need to be able to be allowed to go and drink as much as they can. To make sure that they're hydrated, they should be peeing pretty clear. Shouldn't be too yellow. I know, no one looks, but you should. And for babies, they're not able to tell you that they're thirsty. So being very on top of wet diapers and making sure that they're having wet diapers every couple of hours, give them a little bit of a cool break inside. And babies that are able to, babies that are 6 months or over, can have some water as well, small volumes though.
Kristin mentioned heat exhaustion and heat stroke. I think those are terms that many of our viewers may not really understand particularly well. Brad, could you explain the difference and which one is more worrisome than the other?
Sure. Heat exhaustion is you start feeling tired, but you still kind of know where you are. You're sweating, feeling hot, feeling thirsty. Heat stroke is a different story. You start to get disoriented, you stop sweating, and you just really feel horrible. Heat exhaustion, really just go inside, get cool, drink lots of fluids to rehydrate. Heat stroke, you really need to go straight to the emergency room because you need some aggressive hydration and cooling at that time.
I think that's very important for all of our viewers to know, and especially parents, because by the time children are developing serious heat exhaustion or getting towards heat stroke, they're not really able to tell you any longer that they're feeling rotten. So any hot, dry person who seems a little disoriented needs immediate emergent attention. We've talked a little bit about drinking water, but let's move to playing in water, something we all like to do in the summertime. Kristin, let's talk about water safety, particularly for the kids.
Pools are great fun. We all like to enjoy a nice dip in the pool, but we need to make sure that we're safe while we're doing that. In backyard pools, particularly, kids who are playing around should always have an adult who's within arm's reach. You have to be a very strong swimmer in order to be allowed to not have a parent just within arm's reach. So infants, toddlers, and young children should be watched with an undistracted observer. So that means at a barbecue, if you are having a lot of friends over, there has to be one person that's dedicated just to watching the kids. They should be ideally in the pool with the kids. No cell phones, no iPad, no having a cool beverage. They should not be engaged in conversation. Their entire 100% attention should be based on the kids.
So when we're watching the kids, safety first, no Facebook, right?
Yep.
One other thing I want to ask about, Kristin, is that, I think a lot of people go out and they buy inflatable rings and seahorses and other things, little water wings for the kids. What's wrong with that?
They're fun. They are not safety devices, however. The only thing that would be considered a safety device would be an approved water life jacket. And that is not going to be enough to save a child in the pool who's not being observed. Drowning, unfortunately, is a silent issue. In the movies, you'll see people splashing around and making a lot of noise. But in real life, kids just drop into the pool and to the bottom. It's very terrifying for them. Even children who are decent swimmers, if they are knocked into the pool accidentally, may be startled enough to not realize that they can swim. So always having someone observing and not counting on those water wings. You can keep them if you want, though.
Thanks. That'd be a lot of fun. Brad, who should swim?
So any age should swim. You can start bringing your child in the pool around 6 to 9 months. Supervised, of course. They can't swim. They can't even control their body most of the time. But starting swim lessons early really does help prevent drowning and those kind of issues.
If we take kids in the pool at 6 or 9 months and they can't swim, they can't control their body, when do we start swim lessons, though?
Swim lessons can start 12, 15 months. They're parent-taught classes, but they do start to realize how to swim. I think it's under 12 months of age, if you dunk a baby underneath, they know to hold their breath. So really getting that exposure to them, knowing if water's over their head at a young age before they lose that reflex is important.
I would agree. I think that kids of most ages, except the very young, can and should be exposed to the water. There's some research that shows that doing so and giving some formal lessons, even in kids who don't learn to swim well, they do learn some water safety and some protective maneuvers. So I think that's a great suggestion you've made. We have kids swimming at all ages, adults swimming at all ages, and really important, I think, that adults who don't swim but like to be around the water take lessons at any community center or many businesses that teach swimming. There are classes for adults as well as kids. There are classes for parents and their kids together. So I'd encourage everybody to do that. So we've mostly been talking about swimming and what would probably be a public pool or a backyard pool. And there are some other safety regulations or recommendations for our patients about how to behave around swimming pools that I think would be important for us to talk about. Kristin, how about you?
Sure. If you have a backyard pool installed, you should have a proper fence with a locking gate. So it has to be 4 feet or higher all the way around the pool, and the gate should swing out away from the pool, and it should be able to be locked, an automatic locking mechanism. You can't count on a pool cover to act as a deterrent from children or small people who don't know how to swim getting into the pool accidentally. Also, making sure that you're not running around the pool. Accidents happen. Kids can slip, fall, hit their head, and get into the pool without too much effort, unfortunately. So no running around the pool, okay?
Brad, what about some other safety issues around pools? How about things like diving and jumping in pools, making big splashes? Are there safety concerns in that regard too?
There are. Whenever you're jumping in a pool, you do need to be careful that there's no one underneath you. So a lot of kids will just start jumping, then you end up with like 10 kids all jumping on one another. It's not safe. The other thing is diving head first. You never want to dive head first in the shallow end. It's very unsafe. You can hit your head, break your neck, bad things.
Okay.
But deep end is safe as long as no one's underneath you.
I just want to take a moment and say, this is a health program, and we're talking all about having fun and the rules and regulations of having fun. And just to remind our viewers that we're talking about these things because prevention is the first key to good health. So preventing serious troubles is what we're all about when it comes to summer fun. I love going to the beach, but the beach is not always the safest place for us. Mm-hmm. What do you think about that, Brad?
You really do have to be careful at the beach because the ocean is very unpredictable. It's the opposite of a pool. Pool is a very sterile environment. You know what's going to happen. You have waves, tides that can pull you out into the ocean. The main thing is never turn your back on the ocean. I was at the ocean with my daughter a few years ago. It was her 4-year-old birthday party, and we were playing in the ocean. She was having fun, and she turned her back, and the wave hit her. I saw it coming, so I was there to protect her, but I used that as the learning aspect for her. But never turn your back on the water because it can hit you pretty hard. Even for a good swimmer, adults can drown too. The best of swimmers can still drown if they get pulled out into the ocean. So you do want to be safe around the ocean.
Mm-hmm.
How about beaches at rivers and tubing, canoeing, those kinds of things, Kristin? Any suggestions for our patients for staying safe and healthy in those environments?
Well, those are great fun, certainly. If you are canoeing or you're tubing, you should be wearing a life preserver, a life jacket, and making sure that you're never going by yourself. Should always at least go in twos if you're going to be swimming or on the water. Currents can get quite quick in rivers. Even if you're just going for a little dip of your toes, it can get slippery on the rocks. And the currents can sweep you out. So always maintaining a good safety and caution.
Well, so far we've talked about sun, heat, water and water safety, being careful at the beach. In the summer, in my practice at family medicine at the Palo Alto Medical Foundation, it seems like I start to see a lot more skin troubles than other times of the year. Everything from rashes to stings. Brad, tell me a little bit about common rashes in the summer and how we might treat them. Maybe start with sunburn.
So sunburn, the main thing to do is cool down your skin once you have a sunburn. You want to get in cool water, shower 15 to 20 minutes to really cool your skin down, and avoid sun exposure the rest of the day because you don't want that sunburn to get worse.
Is it safe to use things like solar cane spray and creams and lotions on your skin after a sunburn?
You really don't want to do that. You really want to just get your skin cooled and stay out of the sun for the rest of the day. You want to avoid putting anything on it so that the skin has time to heal itself.
How about other rashes and skin problems that we see? You must see a lot of them in the urgent care.
Yes, in the urgent care we do see a fair amount of poison oak. People are out and hiking, staying in the shade like they're supposed to be, and they come in itchy, rash. It's usually in areas that were exposed while you were hiking or walking. So if you were wearing shorts, if they'd be above your sock line, or on your arms where they brushed up against some of the poison oak. Don't forget the leaves of 3, let it be, right? The 3 leaves on each little stalk that you're looking for. Don't go looking for it though. The treatment for poison oak is immediately wash the skin, get the clothes off that may have the resin or exposure on there, and get those cleaned as well. It can be very, very itchy. So a topical hydrocortisone, the 1% you can buy over the counter, is fine to apply, and it may help a little bit with the itching. Small children particularly will scratch, and we worry about infections because they have little bacteria and dirt under their nails, and they scratch. So to limit some of the scratching, a dose of Benadryl, if it's been safe for your child in the past, is okay, particularly at night. You're bored at night, so you scratch.
And Brad, how about mosquito bites and bee stings and those things? We see a lot of those in the summer too. What should we do when they happen?
So for bee stings, the important thing is to get the stinger out. But you don't want to try to get in there and squeeze and pinch it out. That just releases more venom. Getting something flat like a credit card or your driver's license, trying to scrape the stinger out. Mosquito bites, not much you can do other than to treat the itchiness with some hydrocortisone cream or Benadryl.
Kristin, I'm sure you have patients come into the urgent care, as we do in our family practices, with ticks. How do we take care of ticks?
Well, ticks you worry about after, again, hiking and being out in the outdoors. But any tall grass exposure, you have a possibility of tick exposure. So if you're hiking or walking in the tall grass, checking everybody's body once or twice a day is enough. When you find a tick, you can remove it yourself with some tweezers. You just try and pluck at the base of the head and pull it out. If the head stays in, that's okay. Like a splinter, your body will repel it to some degree. The worry about Lyme exposure is small, but it's real. So if you find a tick that's engorged, which means it's filled with blood, and has been on for 24 or 36 hours, it's a good idea to come in and get checked.
I think that's very important for folks to remember, that we do have Lyme disease in our area, but ticks can't transmit Lyme disease unless they've been attached to your body and engorged for quite some time, more than 24 hours. So if you're showering and checking all over your skin at least once a day, the risk of Lyme disease is very, very tiny. But of course, if you have any questions, always check with Dr. Perkins, Dr. O'Sullivan, or your regular doctor to see if there's a need to be concerned about that. We focused a lot on what to do after we get the bug bite and those sorts of things, but I know there are ways to help prevent them because I want to go out and have fun.
Absolutely.
And I know that sometimes dusk, or when it's getting towards early evening and starting to cool down, is the wrong time to be out if you want to avoid mosquito bites. But it's also a great time to be out for that evening walk right after I get home from work, or before dinner, or just after dinner. What can I do to help protect myself from mosquitoes and other insect bites in the evening? Brad.
Contestant on Jeopardy.
That's right. Insect bites for 100.
Yes. So the main thing is insect repellent. You can get insect repellent at the store, 10 to 30% DEET. You don't want to use DEET on young children, however, and that will help keep the insects away from biting you so much. The other thing are candles. If you're just sitting outside, there are scented candles that repel insects also that you can have out if you're just sitting in your backyard and you happen to have water around.
And I love those little things that hang, and the mosquitoes get in there and go bzzz.
Oh,
And they
yes.
just fry themselves. I love those zappers. But Kristin, Brad mentioned that in younger kids, so you're our pediatric specialist, so what age is it safe to use DEET or other insect repellents on children?
Similar to sunscreen, 6 months or younger. And then in kids that are likely to put their hands into their mouth, I would also try to limit the exposure to DEET in those areas. If you can, have them wear long sleeves, lightweight clothing, long pants, and if their toes are exposed, you can put a little DEET on there. They're less likely to get it into their mouth then.
So up to maybe 3 years old, we have to be a little careful about
Yes.
kids putting things in their mouth. As you said, for kids, we adults might want to think about longer sleeves and pants to help avoid mosquitoes sometimes in the evening. Let's also talk about other fun things besides going for that evening stroll. Wheels. Wheels create a lot of troubles and injuries in the summer,
But they're fun.
They are a lot of fun. So Brad, what do you do for fun with wheels, and how do you make sure you stay safe?
Usually early in the morning, so we avoid the heat. I'll take my daughter out on the weekend. She's 6 years old, and we just make sure we have our helmets on. We ride in the safe parts of the road, bike lane or sidewalk, because she's little. And we go down to the park and have a nice ride. So the main thing is really protecting the head and watching when you're crossing a street.
And Kristin?
I love to see when parents are good role models. So just the other day I saw someone who I know to be a dad riding his bike. He didn't have his kiddo with him, but he was wearing his helmet. So being a good role model and showing that you always wear your helmet as well, because then your children will wear it. So even small kids on the little foot bikes that don't have pedals, they should still be wearing their helmets. Get into good habits early.
Well, I don't have to worry about wearing a helmet on a skateboard or those kinds of things, because as my son would be happy to tell you, I'm hopeless on those devices. No balance at all. But I think also we want to remind parents and kids, wear your helmet when you're on your scooter or on your skateboard, your longboard, your penny board. All of those boards require a helmet. And maybe for those who are less talented, some wrist and knee guards too.
Certainly.
Well, so we're all going to have a lot of fun with our wheels, bicycles, all those other wheeled fun devices. But like my son again would tell you, I'm likely to be the one to fall and scrape or cut myself. Kristin, again, since you work in the urgent care, you probably see a lot of folks with cuts and scrapes from summertime activities. But what can our parents and anybody do at home for home care of minor injuries before they would need to go to the urgent care?
Absolutely. Yes, bikes are fun, skateboards are fun, but some kids do fall, adults too. Just initial cleaning with gentle soap and water is the ideal way to clean a wound. You don't have to get too aggressive. Gentle soap and water. Apply an antibiotic ointment. If you're not allergic, bacitracin or polysporin are probably the ways to go. Get it nice and moist and apply a bandage. And afterwards, when your scrape is starting to heal, cover that with sunscreen too. Now, if you have an injury that you're more worried about, say a wrist is really sore and the child isn't using it, or as an adult, you're not wanting to bear weight on your foot, that might be time to come in and get checked in the urgent care.
So there are some activities that put us at greater risk of sprains and strains and injuring our ankles and things. Brad, you and I in our family practice see both kids and adults, and there are a lot of summer activities that lend themselves to a few more of those sprains and strains and difficulty putting weight on ankles. Just a moment or two, Brad, if you have thoughts about our weekend warrior adults and how to prevent summertime injuries.
To prevent summertime injuries, one of the main things is to exercise regularly. Just make sure you have a good exercise routine to make sure your muscles are strong to be able to go out and play softball, go play 2 rounds of golf, go play soccer with your kids on a Saturday. You're going to pull a hamstring, roll an ankle pretty easy. The other thing is proper stretching. Make sure you warm up, do some gentle stretching, and then go about doing the exercise.
Weekend warriors, listen up. You've got to prepare so that you don't injure yourself. For some people in our communities, Brad, we know that being able to get out and be active is not so easy to do because of health problems or physical limitations. So I like to think that many of us, most of us, would try to be good neighbors and help them out. Do you have any suggestions for all of us about how we can help other folks in our community who are more vulnerable to stay safe during the summer?
So the safe thing is, if you have elderly neighbors, be a good neighbor. Check on them on those hot days. Make sure that they're staying cool, their air conditioning's working. Make sure they have enough water in their house if they need it, if they're not able to go to the store.
I think it's incumbent on all of us to be good friends, neighbors, as well as taking care of ourselves. It's been a lot of fun sitting out here with the sounds of summer all around us, talking about summer safety and good health, but summer fun too. Brad, what are you and your family going to do for fun this summer?
Summer, lots of bike rides, swimming at the local pool. My parents have a spa in their backyard. We don't heat it up too much. We just splash around and relax ourselves. Getting out, soccer practice is starting. It's going to be a fun summer.
And you're going to do it safely with lots of water to drink and
of course.
sunscreen.
Yes.
How about you and your little one, Kristin?
Sure. Well, we have a 7-month-old, so we have several little long sleeve lightweight outfits that block the sun, and we have a small little kiddie pool that I put about 1.5 inches of water in, and he likes to splash. It's good. It's fun.
Well, it sounds like you guys and your families have plenty of fun planned for the summer, and I hope all of you, our viewers, do as well. Please remember that we here at the Palo Alto Medical Foundation, Los Gatos Center, and all of our locations are here to take care of you, keep you healthy and safe when you need it. Well, I'd like to thank my guests, Dr. Kristin O'Sullivan and Dr. Brad Perkins, for joining me today on Health Connections. Please join us next time on KCAT Television, Los Gatos, Monte Sereno.